All right, we're back for our final video here. Now I'm going to talk about death and a little bit about afterlife beliefs. So let's go to slide 19, physical aspects of death. So historically, the causes of death are different, right? In infancy, especially due to infectious diseases, childbirth, war, infectious disease like diphtheria, tuberculosis, smallpox, right? Modern causes of death are a bit different, and they really do vary by our age and by which country we live in. Infectious diseases are still the leading cause in many developing countries, but in developed countries, we have other issues like accidents, homicide, suicide as some of our leading causes. The leading cause of death in developed countries is coronary heart disease. Second most common cause of death in Second most common cause of death is stroke. And then we also have cancer with cell replication, becoming less efficient as we age. So cancer as we age increases. Suicide also is a major cause of death in developed countries. So the major causes of death have changed over time, but really mostly it matters on what age and country you are 20, where we die. Huge difference in where we die between developing and developed countries. In developing countries, the majority of people die at home. Now, it's the opposite for developed countries. Only about 20%, 2 out of 10 of us will die at home. Most of us are going to die in a hospital. This is challenging. Hospitals can provide care, but they are less impersonal. People want to be at home in the comfort of home. When we're in a hospital, we're much more likely to feel lonely, feel fear, untreated pain, and this is really challenging for caregivers in general. So where we die, in our home or in a hospital, again, depends on where you live in. 21, I want to talk about bereavement because that's the experience of losing a loved one to bereave. But grief is this intense psychological response that accompanies bereavement, and we mostly think about grief, and this is varies. Okay, so grieving varies. Having grief is that response, and it changes over time to that loss. We have to reorganize our life and change things, okay? So there's variations and forms of grief, and it does depend on how the death occurred, who has died in the relationship to you. So, for instance, a parent's death can place the child at high risk for depression, or a child's death can place a high risk for divorce. We see that sudden deaths evoke more intense grief. Anticipatory grief can help survivors prepare if someone's been sick for a long time. So there's this emotional arc, and I want to look at that. Slide 22, so really famous study, Elizabeth Kubler-Ross. She developed what she called the 5 stages of death, or grieving to die, theory of dying. And she thought we went through these 5 stages. And that she developed this theory by sitting at the bedside in hospice with, I believe, thousands of patients, and came up with this theory and said that we all sort of hit these things like denial and then anger, and then we bargain. If I stop smoking, can the cancer please subside? Depression, and then acceptance. And so this has been a very influential theory in care of the terminally ill, and how America views deaths, but there are some major limitations. First of all, we may not go through all 5 of these stages, which we know stage theory has that problem. Also, it doesn't have anything about fear. I think oftentimes fear is in there, and I think that lack of cultural context makes a difference, and especially for the idea of fear. So there's not a lot of cultural context taken into this theory, but it is a good framework, like most theories, to think about. 23, beliefs about death. Kind of interesting how how we go through the lifespan and how we view death. So young people understand death is permanent, but they don't understand that it's not inevitable. Adolescents understand death, and beliefs about death are much more abstract and realistic. Really interesting, death anxiety is the highest in emerging adulthood because we have plans, we have goals we still want to accomplish, and death anxiety is lowest in late adulthood, which I think would surprise people. We review our life, we have this expectation for death. Anxiety is the lowest, death anxiety, for those with strong religious beliefs, and highest in people who are unsure of what's next or unsure of religious beliefs. Beliefs about death, so like I said, change over life, right? So young adulthood focuses on fear for one's own child. Middle adulthood may have us doing that life scan, re-examining life. Late adulthood, we're familiar with death and we're much more likely to have been talking about it much more. So beliefs about death do change over time. Slide 24. Beliefs about life after death. So death is not the end in most religions. Morality in life tends to be reflected in what's next in the afterlife. So think reincarnation status, heaven versus hell, right? So there's lots of differences in our beliefs about life after death. There's lots of differences in rituals and funeral observations that we have. Afterlife beliefs around the world tend to be highest in the least economically developed countries. Kind of interesting. So let's look at this chart, afterlife beliefs, survey of belief in life after death. Pew survey, another survey, and it goes along with this, shows that 75% of Americans still believe that there is, or not still, they believe in life after death. Of course, highest among folks like Muslims, Hindus, Catholics, Protestants. Americans generally are pretty tolerant to diverse views on this, but we have a diverse view. And that leads me to my last slide here on these different mourning rituals of major religions, right? So there's lots of rituals. There's lots of ways that there's an honoring of the dead. And so kind of bringing us back to one of the first weeks of looking at Hinduism and Buddhism and Judaism and Christianity and Islam and sort of all those sort of rituals that we do with the body and the beliefs and the way that we what we do and how do we honor, right? So sometimes on the anniversary of death, we prepare their favorite foods, or we light a candle for 24 hours and say a certain prayer, or we have the special traditions like Day of the Dead. Sometimes we visit graves, show respect, offer prayers. There's lots of different ways that we honor the dead and different rituals that we take on. All right, so finish up this video watching a really cool honoring of the dead that happens in New Orleans. It's a 2-minute video, and that will be that. All right, thanks everyone. Looking forward to getting those final photo essays. Take care.